Dr. Zhitnitsky, why is there so much mystery and horror stories for all purpose around wisdom teeth? I mean, what are they? Why do they create so much problem?
Oh, evolution is the culprit of wisdom teeth because we're not chewing raw meat anymore, and actually with every generation our jaw is shrinking a little bit. So new kids, they have no room for wisdom teeth in their mouth, and that's why they're coming in crooked, sideways, upside down, or they just simply get stuck. And the problem with that is that they create a lot of bite problems and infection, and practically every week I see a poor teenager with a swollen cheek because his wisdom teeth weren't taken out properly, and they just left it to infect.
I see. So when should a wisdom tooth be taken out?
I would say that it's obviously an individual decision, but judging by their position, where they're located in the jaw and which way they're angled, and if there's enough room for them to come out, there's a lot of different factors. But it does seem nowadays that a lot of them do need to come out because they will cause a lot of problems. And if they're taken out sooner than later, then the patient actually has much less problems with them, and the healing process is much easier, and there's really much less suffering and aggravation than taking out wisdom teeth on people who are in their 30s or 40s or 50s.
Like with every other operation, as earlier, we have more stamina to survive things like that. And
it's not only stamina, it's just that it's not attached to the bone as much as it when of an older person.
I see.
So technically it comes out much easier, having less trauma and less pain for the patient.
Got it. So again, if a person goes regularly to a dentist, relatively regularly anyway, the dentist will catch it and advise it. And then if you're not too chicken, because it probably is one of those things which doesn't hurt right away, right?
You're absolutely right. And if your dentist doesn't mention your wisdom teeth and you're around 18 years old, then ask him about it. Ask him whether they're coming in straight or they're sitting sideways. Are they going to come out? If you're going to have any problems, always discuss things with your doctor. It's very important.
I had to repeat my high school once, my class, I flunked it and had to do it again. And I'm not so sure I had any wisdom teeth. What do you think?
Absolutely. And if you're going to take them out, it might be better to take them all out at the same time. That way you heal and you won't have to deal with it anymore. Some people say that we'll take it one at a time. And like my daddy would say, why would you want to go to jail 4 times for the same crime?
Yeah, just take them out, because you knock the person more or less out anyway. And I think, for instance, you said that you're doing sedation dentistry. Let's just say a person is a little more afraid than he should be, maybe. Would sedation dentistry be this would be a good place for him to do sedation dentistry, get them all out?
Oh, absolutely. It's a very easy appointment. The patient will sleep through the whole thing, won't remember much, will be completely comfortable, there'll be no pain. It's actually a great way to take your wisdom teeth out.
Beautiful. And then, I mean, an operation like that must be continue to hurt 2, 3, 5, 6 days. Will the person be a little bit sedated then? Will you give him some Valium, some things so that the pain is at an unacceptable level?
Oh, absolutely. We always give antibiotics and pain medication, but the surprising thing that we have found out is that if a person is sedated, recovery is much easier. They don't have a lot of discomfort, and they hardly ever get to use their pain medications afterwards.
Well, that is a beautiful side effect. That's a gorgeous side effect. I'm sure people are very, very happy to hear that. Well, thanks for your candidness. Thanks for being so informative and knowing so much about dentistry. How did that come about? Are you a dentist? That's why. Here we go. All right.
Thank you, Helmut.